Welcome to the AAPT Virtual Convention of 2015. This is a presentation on pharmacy technician duties in the extended pharmacy. It was written by myself, Emma Wickland, and my sister, Megan Erlmeyer. I have been a certified pharmacy technician since 2008, and Megan was previously a certified pharmacy technician, but has recently graduated with her PharmD. Upon successful completion of this knowledge-based CPE activity, pharmacy technicians should be able to list the steps involved with well testing, including cholesterol tests, a body mass index and composition, and a blood pressure test. You'll be able to define cholesterol testing results of LDL, HDL, and total cholesterol. You will be able to describe the role of the pharmacy technician in providing medication therapy management services, and you will be able to list the documents needed for performing immunization services. First, we will discuss medication therapy management, or MTM. Medication therapy management is a program where patients may meet with a pharmacist about their current medications. This is meant to be focused on what each medication is for, like simvastatin is for cholesterol. It's also about how the medication should be taken, in the morning, at night, with food or without, maybe with some extra water. You're also about common side effects for the patient. It is also about the patient's experience with their current regimen. This is to ensure that they are getting the most out of their medications. As a technician, you will be an integral part of the MTM process. You will need to be comfortable speaking with patients and to be knowledgeable about medications and how they are dispensed. Your duties in MTM will likely include scheduling patients for their medication interview with you. You will schedule patients for their face-to-face meeting with a pharmacist. You'll be keeping accurate records and updating a patient's profile as needed. And you will need to be able to bill for medication therapy management practices and ensure maximum third-party reimbursement for your company. Since 2003, medication therapy management is required to be offered to patients with Medicare Part D, these patients who have multiple chronic diseases, take many prescriptions, or pay more than $4,000 in out-of-pocket expenses for their medications each year. Next, we will be discussing your role in health screenings in the pharmacy. First up are lipid profiles. This is also a cholesterol test. One part of the profile will be triglycerides. This is the fats in the bloodstream from food. Excess calories, alcohol, or sugars are turned into triglycerides and then stored as fat in the body. A normal number is usually less than 150, and a high range starts around 200. HDL is another part of the profile. It's called high-density lipoprotein and is considered a good cholesterol. The higher this number is, the better. So 40 is considered low and at risk, and 60 is considered good and can protect you from heart disease. LDL is another part of the profile. It's low-density lipoprotein and considered a bad cholesterol. Optimal range is under 100 and high begins around 160. Your total cholesterol is another part of the profile. This is a combination of the cholesterol numbers and other triglycerides in the profile. This number helps doctors decide if medication is necessary. Cholesterol testing can sometimes take more than one finger prick, so let the patient know ahead of time you will need enough blood to fill the hole in the cassette. To get this blood, you could use a heating pad to warm the blood, prick more than one finger, and operate quickly. It is not recommended to milk the finger to get more blood out of that same finger. Keep in mind that we as technicians are not qualified to perform consultation for patients. Here's a little question for you. Where do triglycerides come from, and which cholesterol is considered bad, which is considered good? I'll pause now for you to think about the answer. That's right, triglycerides come from the food that we eat. The excess calories, alcohol, and sugars are turned into triglycerides and stored as fat in our bodies. HDL, or high-density lipoprotein, is considered a good cholesterol and will help protect you from heart disease. LDL, or low-density lipoprotein, is considered a bad cholesterol and causes health problems. The next part of health screening in the pharmacy is a blood pressure test. To set up your area for blood pressure testing, you'll need the correct size cuff for your patient, good batteries in the machine, and a chair with a sturdy back for the patient to sit and relax in. When a patient presents requesting to have their blood pressure checked, begin by having the patient sit down in your testing area for a short time to relax. I recommend getting the patient registered at this time. Next, you will put the appropriately sized cuff on the patient's upper arm, keeping the cord in line with the eye of the elbow. This is the middle of the crease on the inside of your elbow. Have the patient relax their arm onto a table or comfortably at their side. Then simply push the start button and watch the machine work. The results will be displayed and should be recorded for the patient and the pharmacy if required by your location. Remember, as a technician, we are not qualified to consult patients on their results. Please refer to a pharmacist with any patient's results and their questions. The next part of health screening in the pharmacy is body composition scale. Some pharmacies offer a body composition test with their health testing packages. The scale used for this test is usually very user-friendly and actually my favorite part of testing. The results acquired from this test may include their skeletal muscle, visceral fat, body fat. Begin by having the patient remove their shoes and socks because it is required to step on the scale with bare feet. Please sanitize the scale and handlebar with alcohol or disinfectant before use. Now turn the scale on and input patient data, including their age and height. Ask the patient to step on the scale and stand still while it finds his or her weight. After the weight is determined, the patient should hold the handlebar out at a 90-degree angle in front of their body. Have the patient hold the handles firmly until it is finished determining their body composition. When the scale is finished calculating the patient's results, will be displayed on the screen and should be recorded for pharmacy records and for the patient. Here's another question for you. What would you do after testing a patient and they want to know about their results? Their blood pressure is higher than recommended as well as their LDL. I'll pause for a moment for you to collect your thoughts. Now remember, as technicians, we are not qualified to give consultation to patients about their results. You must refer these questions to the pharmacist because they will be able to help the patient to understand the results and determine what the patient might do to get better. Now Megan will take you on through the immunizations in the pharmacy section.
Immunizations in the pharmacy. Let's start with the influenza vaccine. Trivalent contains 2 influenza A strains and 1 influenza B strain. Standard dose, depending on manufacturer, may be administered to patients ages 6 months and older. Intradermal use is approved for patients ages 18 to 65. It is administered with a smaller needle into the skin instead of the muscle. Recombinant vaccines are manufactured egg-free and approved for patients ages 18 and older. High-dose flu vaccines are approved for patients ages 65 and older. The quadrivalent contains 2 influenza A strains and 2 influenza B strains. Standard quadrivalent shot, depending on the manufacturer, may be administered to patients as young as 6 months old. The nasal spray is a live attenuated influenza vaccine and approved for administration in patients ages 2 to 49 years old. The patients that will be receiving a flu immunization will vary greatly, from infants to elderly and everywhere in between. You may have the opportunity to assist a pharmacist on location during a flu clinic, Remember to smile and be personable with your patients. Now for some brain training. What are the two main categories of influenza vaccines available? Let's pause for a minute and allow you to collect your thoughts. Trivalent, which means there are two influenza A strains and one influenza B strain in the vaccine. Quadrivalent, which means there are two influenza A strains and two influenza B strains in the vaccine. What would you do if an adult patient asks for an influenza vaccine but is deathly afraid of needles? I'll give you another moment to pause and think about this question. First, give them an understanding smile. Let them know you are going to take care of them and their needs. Second, ask if they'd be interested in the quadrivalent nasal spray vaccine. This will alleviate the fear of needles and still protect the patient from 4 strains of the flu. Let's move on to pneumococcal or pneumonia vaccines. Pneumovax is recommended for patients ages 2 through 64 with pneumococcal risk factors. It is also recommended for everyone ages 65 and older. Prevnar 13 is recommended for all children under 5 and adults ages 65 and up. It is also recommended for patients between 6 and 65 with pneumococcal risk factors. The most common recipients of this vaccine will be older, so be sure to speak up and speak clearly. Help answer any questions the patient may have, and refer them to a pharmacist for any questions you cannot answer yourself. Perhaps you can also look at their profile and determine other immunizations that should be recommended to them. Medicare Part D is currently covering the pneumonia vaccine. On to herpes zoster or shingles vaccine. It is approved by FDA for patients ages 50 and older, although there are no long-term case studies for ages 50 through 59. It is recommended by the Center for Disease Control and Advisory Committee on Immunization Practices, or ACIP, for patients ages 60 and older. It is still recommended for patients that have experienced shingles to receive the vaccine to reduce the risk of another occurrence. Medicare Part B does not cover the herpes zoster. Let's go on to another brain training session. How would you handle a situation where a patient says they don't need the herpes zoster vaccine because they have already had an outbreak of shingles? Let's pause for a moment and think about this. Smile and let the patient know you care about their well-being. Show them you care about what they have experienced with shingles. Explain to the patient that they are still at risk for further outbreaks of shingles if they do not get vaccinated. The best way to protect yourself is to get the vaccine, even if you have already experienced the virus. Tdap contains tetanus, diphtheria, and pertussis, also known as whooping cough. This vaccine is usually given at 11 or 12 years of age. If it was not administered at age 11 or 12, it is recommended to be administered as soon as possible. Tdap is recommended by the CDC to be given to pregnant women for each pregnancy to protect the baby from pertussis. There is a vaccine with only tetanus and diphtheria, which is called TD, and should be given as a booster every 10 years. With Tdap, it's an advantage to the patient to administer 3 immunizations with 1 shot. Unfortunately, this can be a hindrance if the patient is allergic to any of the 3 components. Brain training. Who other than those listed in the previous slide might be a good candidate to receive the Tdap vaccine? Let's pause for a few seconds and think about this. Parents, grandparents, or family members around newborns, people around small children, and babies in general. Someone in need of protection from tetanus after being cut or scraped by rusty metal. Hepatitis A and B. Hepatitis A is approved for patients ages 1 and older. It is given in a dose series at 0 and 6 to 12 months. Hepatitis B is recommended to start the series at birth and be finished within 6 to 18 months. It is given in a 3-dose series at 0, 1, and 6 months. Twinrix contains both hepatitis A and B. It is approved for patients ages 18 and older, given in a 3-dose series at 0, 1, and 6 month intervals. It is also given in a 4-dose series at 0, 7, 21 to 30 days, and a follow-up 12-month dose. On to meningococcal or meningitis vaccines. Menactra, Minhibrix, Minvio, or Minimmune. The highest risk of meningitis is between the ages of 16 and 21. It is recommended for adolescents 11 or 12 years of age, and a booster dose is recommended to be administered between ages 16 and 18. It is also recommended for at-risk children ages 2 months to 10 years old to receive the vaccine. MMR, or measles, mumps, and rubella, is administered to children in a 2-dose series at age 12 to 15 months and 4 to 6 years. Patients will need proof of this vaccination to attend most colleges. If they haven't been vaccinated already, the 2-dose series needs only be separated by 28 days. Let's talk a few minutes about what you will need. Patients' demographics, patients' drug allergies, patients' insurance, vaccine administration record, signed HIPAA notice, vaccine information sheet for the patient, immunization assessment if necessary to decide what other vaccines are recommended. Let's review again what should be collected prior to administering a vaccine with a little brain training. What paperwork should be gathered for a patient to be vaccinated? Let's take a few moments to recall this information. Vaccine administration record for the pharmacy, signed HIPAA form for the pharmacy, vaccine information sheet for the patient, and immunization assessment for the patient. While collecting information and discussing vaccine with patients, remember to spice up your workday. Enjoy your customers, always smile. It truly is the best part of your outfit.
Study number 1, Katie Truthat, certified pharmacy technician, leads the immunization team at her pharmacy. She plans for her upcoming time off by training her coworker on immunization duties. What 5 items will Katie discuss with her coworker during the training process? We will allow 5 minutes for you to compile a list or compile an answer to the case study question. So the slide will pause for 5 minutes, and the next slide will show our suggested answer to the case study. Case study answer. Katie will train her coworker on the following items: types of immunizations available at the pharmacy, patient information that must be obtained, such as drug allergies and insurance coverage, the VAR or vaccination administration record, signed HIPAA notice by the patient, and vaccine information sheet that lets the patient know the details of the vaccination. Case study number 2. Mrs. Goldilocks is a 5'4", 180-pound, 47-year-old in average health. Her current medication regimen includes Effexor XR for mild anxiety and atorvastatin to help manage her cholesterol levels. Mrs. Locke's insurance will pay for only one health screening service at the pharmacy. Which health screening will provide the greatest benefit for Mrs. Locke and why? The slide rotation will pause for 5 minutes while you compile your answer to the case study, and our suggested case study answer will be shown on the next slide. We'll pause for 5 minutes to allow you time to review and write your answer. Case study answer. Mrs. Goldilocks will benefit from both a lipid profile and a body composition scale. Since she weighs 180 pounds, she's overweight according to her age and her height. And doing the body composition scale, she may be able to use the results to formulate a health and nutrition plan with the pharmacist. The lipid profile is also useful in determining the effectiveness of her atorvastatin therapy. Takeaway challenge. So with this continuing education offering on pharmacy technician duties in the extended pharmacy, one goal is to provide information and share knowledge of the subject matter. And the second goal is to motivate you, the CE participant, to take knowledge away from the CE and immediately apply it to your practice. So what we would like you to do, this is our challenge for you, is to share at least one extended pharmacy knowledge point that you learned within this continuing education, to share that point with your pharmacy team. What point will you share? Our second takeaway challenge is to initiate an extended service not currently provided by your pharmacy. Think about what service that would be, and then what the steps are to putting that service in place. So we will pause the presentation again for you to jot down what you will do for your takeaway challenge.